Okay, we're going to continue learning about what a nursing assistant does. So we started an introduction into what healthcare services was, but this is also, what does a nursing assistant exactly do? We talked about it a little bit in the last chapter, but we're going to expand on that now. So when we're looking at what a nursing assistant does, and let's see if we can get this to change here. There are many federal and state laws that will regulate what a CNA can and can't do. Title 42 is a federal law that is made by Congress, and they dictate how many hours you have to have of training, what's required in that training. They have what we call a nurse registry that you have to get entered into once you get your CNA, and it dictates what you have to do to get your CNA renewed every 2 years. Then there's Title 22, which is a state regulation for California. And California has its own rules, and they say, yes, those federal rules are great, but we want those, plus we want other things as well, that we don't think what the federal law has stated is enough, and we're going to dictate even more. Then there's the State Nurse Practice Act, which is for California, and it dictates what a nurse can and can't do, RN, LV, and CNA. And then there's the Omnibus Reconciliation Act, OBRA, of 1987. And OBRA is part of that federal law. It's part of a federal regulation, and it was what got involved in making things better in nursing homes. And to do that, they felt they had to make things better in training our CNAs. So the Nurse Practice Act regulates what RNs, LVNs, and CNAs can do, how much training they have to have, and it allows for revoking or suspending a nurse's license. If you're not doing what you should be doing and you're doing things that are dangerous and you're a risk to your patients, then we need to fix that. And so it's there to protect the public. So OBRA, that Omnibus Reconciliation Act in 1987, is a federal law that applies to all 50 states, and it was done to improve the quality of life in nursing homes. It sets minimum training and competency, and it requires a nurse registry in every state. Now, to give you an example of how this works, I told you that there's Title 42 federal law that says minimum training. They say the minimum training for a CNA is 75 hours, and then you have to show a test to show that you're competent. Okay, 75 hours. But in the state of California, Title 22 says that in California, that's not enough. 75 hours is not considered enough to truly train you in all the knowledge that you should have to take care of our frail elderly population. And so even though the federal law says that you have to have a minimum of 75 hours, state laws can override that. They can't, and what I mean by overriding is you have to do the minimum. Every state has to do that minimum of 75, but individual states can require even more. And California happens to be one of the states. There's actually 3 states that require an extensive amount more, California being one of the main ones. California state says it's not 75 hours training total. It is 60 hours in theory training that you have to have and 100 hours in clinical that you have to have. So you need 160 hours to meet the state regulation. So at the college, we have to look at what does the state require, what does the federal law require, what does our college require, and whatever is the highest, that's what we have to do. The other thing that OBRA states is they started a nurse registry in every state. And so once you become a CNA, your name is going to go into this state registry. And what that state registry is there for is to make sure that if, let's say, you get fired at a job for abuse, okay? You abused someone and you got fired from your job, and that's going to get turned into the nurse registry that you got fired for abuse. So any place that hires you, any place that hires a CNA is required by law to contact the nurse registry and make sure you're in good standing. So basically, I'm going to tell you, you abuse a patient, you'll probably never work as a nurse again in your entire life. But that nurse registry is required of, so any place you go to get a job, they're required to call and just make sure that you've done the proper training and that you are in good standing. Now, to keep your CNA current, and we'll talk about this again at the end of the semester, because even though I'm going to tell you about it now, you're going to forget all about it by the time we get done. Right now, you're just worried about getting your CNA. But once you get it, how do you keep it? You have to have 48 hours of continuing education every 2 years, at least 12 in each year. So what I mean by that is you can have 12 one year, 36 the next, or 24 and 24, or 36 and then 12, but you can't do all 48 in 1 year. You have to have at least 12 in each of the years, and a total of 48 every 2 years. Now, to me, that is so unfair. As a CNA, you're required to do 48 hours of continuing education every 2 years. As an RN, I'm only required to do 30 hours of education every 2 years. I can do all of mine online. I can do and it can be in any topic I choose it to be in. With the state, your continuing education, they dictate to continuing education providers what they can teach you and what they can't teach you. And they make sure that your 48 hours, only 24 of it can be online. The other 24 has to be live education. And you can work as a paid, and you have to work as a paid position as a CNA during that 2-year period where you're supervised by an RN. So you can't just volunteer or do community work. You have to work as a CNA, a paid CNA, where you're supervised by an RN to keep your license current. As an RN, I only have to have 30 hours of continuing education. It can all be done online, all in one self-study module if I wanted to, and I don't even have to work in that 2-year period to renew mine. So I'm not sure why the standards are so different for a CNA, but that is what you're going to need to do to keep your CNA current once you get it. Now, some roles and responsibilities for a CNA is you need to know what your scope of practice is. So scope of practice, so each state has state laws. They have a governing board where they have the Nurse Practice Act, which says what your scope of practice is. What can you do as a CNA? What can you not do as a CNA? You'll also have a job description, and a job description is something your employer will give you of what their expectations of you are. And then do you have the necessary education and training to do what's expected of you? Hopefully we will give you that, everything that you need in this class. But there will be times that things that will come up and it's like, gee, I heard about that, but I don't really remember it, or I didn't really have much opportunity to do that when I was in training. You just need to make sure you have the right to go to that RN and say, you know what, I need some help with this. I need to be supervised. I need education for this. So there should be a nurse available to answer questions and to supervise you. Our goal, one of our biggest roles and responsibilities as a CNA, is to help meet the patient's needs with activities of daily living. Now, the term patient versus resident, you're going to hear them kind of used interchangeably. Generally, in a hospital, we refer to people we take care of as a patient. In a nursing home, we refer to them as a resident because they reside there. When you do home care, you refer to them as clients, but a lot of times you'll just hear them referred to as patients, but you'll hear those different terms, and then a lot of times, like I said, they're interchangeably used. So our goal at a hospital and a nursing home is to help meet their needs, their activities of daily living. If we're doing home care, we're not only going to help with activities of daily living, but we may have to do some laundry, some shopping, preparing meals, light housekeeping. If you're doing home care and they're saying, hey, I want you to scrub all the tile with a toothbrush, that's not what your job is. Your job is to take care of that patient. But in a home setting, taking care of that patient means taking care of their environment as well. And we do always want to make sure that, we're straightening up after them and ourselves. And again, we may have to cook for them. So that's going to be part of it. I liked this picture. It says, I've always wondered why you decided to be a dog. And it says, I was fooled by the job description. Job descriptions are things that you get when you get hired by a facility. So if a facility hires you, they're going to give you a job description of what the expectations, what they're expecting you to do. And you always want to read through that before you sign it. Because if you're seeing things on there that you're like, I don't really think that should be part of my job description, or I'm really not I'm not comfortable with that, you need to speak up then and make sure you're not signing that you're okay with it if you're really not. Now, the one thing that I have found about job descriptions is I think every job description I've ever signed, there's always this clause in there that says, and other duties as assigned. What does that mean? It could mean anything. But generally, job descriptions will kind of outline what the expectations for you are. Some roles and limits for nursing assistants. Don't act beyond your role or training. If you're doing something that's not within your scope of practice, so we're going to help with activities of daily living. So let's say you go and you give a medication, or you do a real complicated, bandaging treatment or something. You're acting beyond your role of training. You are basically practicing medicine without a license. You are not licensed as a CNA. You are certified. LVNs and RNs are licensed. CNAs are certified. And so you always want to make sure you're staying within your role and your training. We do not give drugs. I did mention that you are allowed to do topical over-the-counter ointments, and that's it. You're not allowed to give over-the-counter oral tablets like Tylenol or Motrin, but just topical on the skin ointments. We don't insert tubes or objects into the body, but there is an exception for enemas. So depending on the facility you work at, an enema is actually something that you are allowed to do as a CNA, but depending on what facility you're working at, they may or may not allow it. So for instance, one of the skills we are supposed to check you off on in this class is an enema. Well, we are going to end up needing to do that on a mannequin. We're going to end up basically demonstrating it, having you demonstrate back on a mannequin. Because the problem is all the facilities we go to for our clinical rotations, none of them allow their CNAs to actually do it. I know you're really crushed at this thought that you're not going to get to give this enema. But the problem is now you go get a job at a hospital, and hospitals do allow their CNAs to give them. And so that first time you give it, you're going to need to tell the nurse, you know what, I was trained in my CNA training, but I never got to do it on a real person. Can you help me the first time? Okay. So you have the right to do that. You are not allowed to take oral or phone orders from doctors. Okay, so if a doctor calls and says, I want to leave an order for so-and-so, you have to say, excuse me, I'm sorry, I can't do that for you. Let me go get you the nurse. Do not do procedures that require sterile technique. So we're going to be learning a lot of differences between clean techniques and sterile techniques, but clean technique we can do. Sterile techniques we can assist, we can hand things that in a sterile environment, but we don't do sterile procedures as a CNA. Never tell the person or family the person's medical diagnosis or surgical treatment plans. That's the physician's job to do that, or the RN's. Never diagnose or prescribe treatments. We don't supervise other CNAs. So LVNs and RNs can supervise LVNs and CNAs. LVNs can supervise CNAs, but CNAs don't supervise other CNAs. We do not ignore a request to do something. No one can force you to do something beyond your legal limits. But if it's beyond your legal limits, you need to just tell them, I'm really sorry. I want to help you, but I can't. I'm not allowed to do that. So just explain why can't do it. Don't do it. Don't just walk away and say, I'm not going to do that. That person's crazy. I'm not allowed to do that. Where they're thinking it's getting done and now nothing's happening. So make sure you always just tell them you're not allowed to do something. So that is the end of that chapter, and we're going to stop here and take a little break.